You are watching McLaren Port Huron Today's Health Program, and in today's program we're talking about bariatric surgical services that are available for women with Dr. Karen McFarlane. Dr. McFarlane, we are on to the gastric sleeve procedure now. Can you explain to me what that is?
Well, actually to add is that we call it the vertical gastric sleeve, and we actually have a diagram which will help a lot. So with the stomach, again, just to get a frame of reference, like a big balloon, roughly starting from the tip of your middle finger towards your wrist. And the difference is we're making it the size of your thumb. All right, so we're actually removing anywhere between 2/3 to 3/4, otherwise 75% of your stomach. Okay, so the first thing we're trying to think of, how can this really help us? Well, this falls into the category of what we call restrictive procedure. Usually your stomach is a stretchable balloon. When we make it this narrow, it doesn't stretch as much. So you get a fuller quicker in terms of sensation. You cut back on your appetite, and as a result, you end up having your weight loss.
Very good. So what would be some of the pros and cons of this procedure?
The pros and cons, particularly the pros, is you don't have to alter the anatomy. And actually you have an animation to go over too. So when we start, again, your incisions are roughly as long or as wide as your index fingernail. All right. We use adaptable ports to look inside or access your abdomen. And the instruments we use are roughly the length of this pointer. As we focus on your stomach, we actually use a tool or a long tubing to be able to insert the tubing into the stomach. Normally, food goes in and basically washes all throughout the entire portion of your stomach. When we start using the sleeve in itself, we're actually using a stapler all the way along the length. This is a permanent procedure. You actually do lose 2/3 of your stomach.
So what would be the complications of a surgery like this?
Well, looking at what we call a staple line, the risk for the staple line is it can separate. We call it a dehiscence. That leads to what's called a leak, and which could be somewhat dangerous. Okay. Usually when we do these procedures, we use additional adjuncts such as glues, and we actually test it like a bite tire test to make sure everything is well connected.
So for someone that chooses this type of surgery, what type of weight loss would they expect?
The weight loss is primarily what we call focus on the restrictive portion. So using what we call percent excess weight loss. If you're 100% pounds overweight, usually you can lose about 60% to maybe 70% of that weight for most people. All right. But the main thing I do want to emphasize is called behaviors. Each of these surgeries will not work unless there's rules that are done, one of which you have to eat. Many people lose the desire to eat once they have these operations, and that's to be warranted, that's typical. Usually the foods that at most they can manage is no more than what fits in the palm of their hands. Okay. On top of that, you do have to still be fairly active. This is just a tool. Just a tool. Again, behaviors and following the rules in terms of eating, good selection of vegetables and fruits, and staying active is the biggest winner.
So we've talked about 3 different types of procedures that we do here at the hospital. Which one is the most common that you perform?
Well, just to be fair, I do it all, all right? And I do also the bypass. Most patients may seek that primarily if they're looking for immediate diabetes resolution. Those who have severe heartburn, reflux, or indigestion, the bypass tend to favor in terms of improving those symptoms altogether.
So someone may come in thinking that they want the sleeve, and then after discussing it with you, they may be a candidate for one of the other procedures?
Well, our job is whatever you ask us to do, we're trying to provide it for you. Our job is to do the homework to make sure it's a safe option. So for example, patients who come to us who have horrible heartburn, I mean, they're on antacids, Nexium, Tums, and not having relief, with good conscience, I could not tell them have a band or have a sleeve, because there's a potential to make that far worse. So again, knowing what your ultimate goal with your weight loss helps us to guide what will be best for you.
So after someone has a procedure, what's the follow-up like?
It depends on the operation. So for a band, usually the follow-up will be a monthly follow-up until you get to your sweet spot. Your goal weight loss is roughly about 8 pounds a month. All right, and that usually takes about, let's say if someone's trying to lose 100 pounds, it may take you a year and a half to get there. With a sleeve and a bypass, the follow-up is usually every 3 months and then yearly after 1 year. Most of the weight loss, let's say for those looking to lose 100 pounds, can get there within 6 months with the other procedures. That includes the sleeve and the bypass.
So it's a little bit of follow-up then with the
Follow-up is absolutely essential, primarily because we're still learning more about why these procedures work. For example, why is it that with a bypass, it's really good for patients who are diabetics? In countries outside the United States, such as South America, including India, they already have a surgical cure for diabetes, and that's a variation of the bypass in itself.
Very interesting. Any closing comments for our audience?
Overall, we cannot change people's behaviors, and regardless, all these procedures serve as a tool. By all means, if you have any questions, feel free to go to the Bariatric Center of Michigan at McLaren. We'd be happy to assist.
Very good. Well, thank you so much for this information.
Thank you for having me.
Thank you for watching McLaren Port Huron Today's Health Program. If you have questions about the program, you can call us at 1-800-228-1484 or email us via our website at www.mclaren.org/phcontact. You can order a free copy of the program or access reliable health information through our website at www.mclaren.org/PHTH. As always, tune in next week for Today's Health. Today's Health is brought to you by McLaren Port Huron. McLaren Port Huron, doing what's best.